today we're going to talk about headache and migraines and how massage can help the migraine and headaches. So a lot of people spending time at the computer desk, sitting position, and this is really affect your lifestyle and affect your headaches. Some people being born with this, like a type of problem in the body, like headaches and migraine, and this is a different story. We're not going to talk about this, but today we're specifically going to talk about postural problems. And like I said, it's the constantly sitting at the computer desk, put this radiation in your eyes, and change your posture. So what's first thing first, when people come in and they tell me, I have a headache, I always look at the posture. I'm cold hands. I'm cold?
Yes.
Oh, nice. I like it. I like cold hands. So the first thing first, I look at the position of the neck and position of the head. You guys know people tilted, and the really important things, it's positioning all your occipital area, okay? Because sometimes we look at this big spinal cord, right in here, and artery and nerves coming down here. And just think about it, if your head leaning one side all the time, what's going to happen? It's going to jam, right? And that's going to create a lot of tension. Sometimes people feel like something going on up here. They get up and they describe like a sharp, like a lightning comes up to the head. And this is what exactly you need to pay attention. Also, we going forward, our head is go forward, and it's jammed this artery and nerves here, and it's created Dow's hump. So you know that really, yep, that's stop right here. If you turn around, you're perfect candidate. Look at this. See, Dow's, yeah, Dow's hump, and it's create like you can feel that bone is sticking out. C7, T1,
yeah.
Correct. And this is what I'm looking for. So now I'm gonna look at the Marina head and just see what's going on. You can guys also play with me. Just make sure we're not gonna stay in the camera away. So what I'm looking for the how's the head looking. Remember we checked those eyes positioning, and what I see. What do you guys see? Can you see it?
Check it. If you stand on her left side, you didn't do the same thing.
Yeah. Okay. So as you can see. I don't see.
Yeah,
but
she has a left, well, that's her left side, and it lower, so on the right side's elevated.
Yeah, so, and she's not bad, but you can see a little bit different, so it's something shifted up there. Let me check again. Sorry, I gotta lock the camera out. Yeah, you're right, left is a little bit higher.
The left is lower, right is higher.
Yeah, so now, so even sometimes we have like, tension, and it's like really like pulling one side higher than another, and you have a tension. So even massage the head can help. But the next one, what I want to do is that the problem here or it's problem in the lower back, because most of the time I'm going to show what's happening with the people. So when they sit down, they're sitting for maybe 10 minutes okay straight. But after, they start getting tired, and they're doing this. So I'm always go that way. So I put my pressure on that buttocks, on my glute. This one is up. My spine start twisting. Look, my spine twisting this way, but my brain, they still want to look like I'm sitting straight, and they start doing this compensation. And my head is tilted, my head is jammed. Most people, what they do, it's another problem. They have two screens, or they have some other stuff on the side, and they always look, and what they do, they turn and go in this way, or they look up and it's jammed, and it's the problem. And that's what the problem is. We always look at the occipital area. We want this smooth and nice. And the first test is called Burberry test. What I usually do, people coming close to this, something you can sit, to massage table, and I place two hands right in this occipital area. I place it right in here, okay, on the side. And what I want to feel, if any, like, how's it feel the tension? So I place it, there we go. And now I ask the person, sit down. So sit down, go ahead back and sit down. And I feel the tension is released on the right side. So when she's standing, I feel tension, but when she sit down, it's releasing on her left side. Sometimes people sit down and it's no changes. If this is no changes, the problem in the neck, okay? So if she stand up, and I feel, okay, tension, and she sit down now, and it's gone on the left side. So it's something going on with the sacrum, sacroiliac base, yes. So this is always, I know it's kind of like hard to understand in the
Very
beginning,
nice.
yeah, but you guys start practicing this really cool stuff. Ask people get up, hold it, and ask him to sit down. And you will feel the difference. And this is really, really,
It's
so-
like harder when
Yeah.
you feel the tension.
yeah, it's a last, when you sit down, it's the pain is gone. I mean, the tension is go away. So when you stand up, I feel restrictions. So they mean you push pressure probably one on the left side, and when you sit down, it start try to correct it, and it's more balancing. So I'm always check people in a standing position and sitting position, and this is really important because when we sit, it's completely different when we're standing. So this is the couple test. Also, like I said, we watched this hump, which is already there, and the first thing first, we're gonna start work on it. So we're gonna start in prone position. I don't apply any oil. I would like to work on thoracic area and pull that fascia and close this faucet, because as you know, as you look at this way, when people around it, the faucets is get open, okay? And we want to lock it back, so we want to do this. And also put that douge hump back, okay? So the first one, people do V section, like V sign. I like to place my hands together just like that and create V this way with the thumbs. And what I'm doing here, I found that hump, that C7, T1, and what I'm doing, I'm start pushing up. Okay, and I do 2 times, 3 times without helping, without Marina's help for me. And how's it feel, Marina? Always ask feedback.
Good.
My hands is straight. Is that okay? You feel good?
Yes.
Okay. So now what I'm gonna do, I'm gonna ask Marina, and I can feel something on this side more. So this is also good assessment of the spine. When you guys start do like a stroking down, you will feel actually this side is kind of push me on the side. So something going on. It's maybe the spine is rotated this way, and you will feel it. You guys are gonna try it later. So what I'm doing here, after a couple times, and you can go a little bit lower. We have the bra, so usually you can go all the way to the lumbar area. It's actually really good. But now, what I'm gonna ask, to Marina, start raising her head up. Try to raise. And you see she helping me out with lock it in, okay? How's it feel? You feel good. And then sometimes it's click, you feel the click. How many pounds pressure? You apply like a 20 pounds pressure. Good, really good. And relax. Next one, this is the fingers. You can also use your forearm. It's the same, but you can just do one side. I'm gonna apply my forearm, I'm never apply my elbow. So I come in up here, grab that fascia. You see, I'm moving her with my arm. If I got too much oil, I'm just gonna slide away. And what I'm doing here, I ask you to start, take a deep breath, raise yourself up, and raise your head up. And now she's raised, I'm hold it, she's lower down. I'm hold it, and she take a deep breath again and raise again. Raise again, and I follow more, okay? This is one of the this is the 2 of 2, the technique. Next one, it's another one, and you guys, like I said, you're gonna try it. You ask the clients, put the hands close to the body. It's like a cobra in the yoga, and bring her a little bit up. So go ahead, raise your head up, right here, and chest up, and stay here. What I'm doing here, I'm gonna ask her to tuck her chin constantly. Okay, really slowly, just like that. And what I'm doing, same thing, I'm standing up here, and she's moved down, tuck your chin, and I go down. So you see, she's going down, I'm going down too. She stay there, I finish, Now she raised her head, I'm come back to this position, and she tucked the chin, and I'm working again. How's it feel, Marina?
Okay.
It feel good. So we want that, eliminate that part, okay? All right, so now it's your turn, guys. Watch. So if I hit that spot,
Mm-hmm.
I'm just kinda, I'm trying to do like spine
Straighten it out.
manipulation, yeah, and you can feel it,
Okay.
okay? But usually after a couple, like 4 or 5 times,
Doesn't matter.
yeah, it's getting better.
Yeah.
And what she's gonna do, she's gonna do movements, and that's really gonna help her, okay?
Alright. So then we're gonna ask her to do that while she's lifting her head up, right?
Yes, now you're gonna do yes.
Okay.
Ask her to do lift the head up. Uh-huh.
So now while I'm going down, you're gonna elevate your head up and down, okay?
Yeah, raise your head, and yeah, a little bit closer up here, perfect. You see, I don't
I'm
want,
like going crooked.
yeah, I don't want this,
I don't like that.
I don't want this, the thumb is get
Yeah.
really bent. Why? Because if you're gonna do this 4 or 5 times a day,
It's gonna be out quick.
arthritis, you're gonna get arthritis here.
Show me how you're doing your hands, how you're placing them.
Like here, so, like this, and you're doing this, watch. And you come up here, and you just push. And it's not necessarily have to be, so, yeah.
So hard or
Yeah,
anything like
or
that.
just like
Yeah.
this, and you
Okay.
push, and she raise up. But,
You're able to see that,
yeah,
right?
just try it. It's, a couple days ago, the lady shows up in the clinic, and she said, oh, please, my thoracic hurt and my neck hurt. And I'm like, okay, let's work on your neck and thoracic. And she said, please don't work on my neck. And I asked her why, because she said, I went to some massage place and they really like aggressively work, and she's so sore and she can turn the head. So what I did, yeah, we restored a little bit movements.
Go ahead and lift your head up.
Uh-huh. Very
A
slowly.
little bit, a little
And tuck
bit,
your
a
chin,
little
tuck
bit.
your chin, tuck your chin, yes. So don't forget to tuck your chin. Now this one is the
It's
next.
different.
Yeah, this one is
yeah.
different.
How you do your hands like this?
Yes,
Oh, okay.
you will do it too. You will do
Yeah.
to Miranda. We're gonna
No,
switch.
no, you did that before. I know.
Yes. So now you can use your forearm, and this is right in here, forearm, and you
Okay.
say same thing. When she's breathe, you ask her to raise up, and you. The idea is not pushing on the spine, okay? Just work on that. Yeah, she got the bra. It's not. Scoop fascia. Always work with fascia. You see, no oil, no oil at all. Yes.
How does it feel?
Good.
Slowly. Yeah. She go down, and you
Go really
Yeah.
slow. Like,
Yeah,
as
really
slow as
slow.
I'm going my arm.
start pulling her down, and ask her tuck the chin now. Tuck the chin. Tuck. Yeah, right there. Tuck the chin. You feel that? Yeah, you're pulling out. Good. Tuck the chin and let it go. Perfect.
And then now you're gonna go ahead and
Cobra, yeah,
cover
cobra
your
position.
arms, cover your arms. Can I
And
still
it's-
use my arm?
Yeah, you can use your forearm, or you can use the
thumbs too.
thumbs. It's actually more easy because you
Yeah.
see she creating this.
You could see it.
Yeah, I like this one. I like this because I can really grab that. I can work on that
It gives you more room.
spine. Yeah,
Okay.
it's reactivated. Perfect. Yeah, like I said, if this is do like a fist like this, like what's those girls fighting? They do fist like this. Or
Oh.
some people doing fist like that.
No, that's better.
Yeah, but the fist, yes, and this is, you see, you create that movement, so your knuckles is navigating,
Yeah,
and you
and
ask her,
they're not
and you ask her to
collapsing.
move, yeah,
Go ahead and lift your head up
Head
just
up.
a little bit.
Uh-huh.
Very slowly, very slowly.
good.
You can see
And
it.
tuck the chin now, tuck the chin, you see she's tuck the chin, and sometimes when she tuck the chin, you will see this one, it's like, you see this one is tension more,
Mhm.
and there's no tension in here at all, so yeah,
Okay.
and it's really important.
That's a really nice trick.
Yes, it's a night trick, and this is probably what I'm due for in this position. Most it's a face up. So yeah, let me just bring her because I think she's really tense.
Oh.
Take a deep breath, all the way out.
Oh,
Ah,
good.
Oh my
Yeah.
God.
Neck,
So,
neck.
I mean, yeah, we try to be nice. We doing.